So cells of the temporal bone, cells of the temporal bone, cells of the temporal bone. It is divided into medial ear and mastoid. Cells of the medial ear and cells of the mastoid cavity. Cells of the medial ear are cells of epitympanum, mesotympanum, hypotympanum, and posterior tympanum. Epitympanum, mesotympanum, hypotympanum, posterior tympanum. Cells of the mastoid are superior, inferior, anterior, posterior. SIAP, superior, inferior, anterior, and posterior. Epitympanum cells, cells of epitympanum, that is of the middle ear and mastoid. Cells of the middle ear are epitympanum, mesotympanum, hypotympanum, posterior tympanum. Epitympanum is supralabyrinthine and perifacial, supralabyrinthine and perifacial, supralabyrinthine perifacial. Cells of mesotympanum is anterior group of peritubal cells, pericarotid cells, supratubal cells. Anterior group of peritubal cells, pericarotid cells, supratubal cells. Cells of hypotympanum are infralabyrinthal cells, infralabyrinthal cells. Cells of posterior tympanum are facial recess 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 cells. So epitympanum, supralabyrinthine, perifacial. Mesotympanum is anterior group of peritubal, pericarotid, supratubal cells. Posterior hypotympanum are infralabyrinthine cells. Posterior tympanum are facial recess cells. Cells of the mastoid cavity. Superior group, peritegment, perilabyrinthine, sinodural angle, retrolabyrinthine, periantral, zygomatic hair cells. PPSRPZ. Superior group is PPSRPZ, that is peritegment, perilabyrinthine, sinodural, retrolabyrinthine, periantral, zygomatic. Peritegment, perilabyrinthine, sinodural, retrolabyrinthine, and periantral, zygomatic. Peritegment, perilabyrinthine, sinodural, retrolabyrinthine, 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 periantral, zygomatic. Peritegment, perilabyrinthine, periteg, perilab, periteg, perilab, sinodural, retrolab, and periantral, and zygomatic hair cells, Inferior group of mastoid tip, retrodigastic, that is medial tip cells, peridigastic, lateral tip cells. Inferior group of mastoid tip, retrodigastic, peridigastic, MRP. Inferior group is MRP. Anterior group is perifacial, retrofacial, facial recesses, PRF. Anterior group is perifacial, retrofacial, facial recesses. Perifacial, retrofacial, facial recesses. Posterior group is perisinus, retrosigmoid. Posterior group is perisinus and retrosigmoid. Perisinus and retrosigmoid group. So for epitympanum, supralabyrinthine, perifacial, mesotympanum, anterior group of peritubal, pericarotid, supratubal cells, hypotympanum, infralabyrinthal cells, posterior tympanum is facial recess cells, superior group is peritegment, perilabyrinthine, sinodural angle cells, retrolabyrinthine, periantral, zygomatic hair cells. Inferior group are mastoid tip, retrodigastic, peridigastic cells. Anterior group of perifacial, retrofacial, facial recess hair cells, and posterior group of perisinus, retrosigmoid. Epitympanum, supralabyrinthine, perifacial, mesotympanum, anterior group of peritubal, pericarotid, supratubal cells, hypotympanum, infralabyrinthal cells, posterior tympanum, facial recess cells. Superior group is peritegment, perilabyrinthine, sinodural, retrolabyrinthine, periantral, zygomatic cells. Inferior group are mastoid tip, retrodigastic, peridigastic. Anterior group of perifacial, retrofacial, facial recess cells. Posterior group are perisinus and retrosigmoid hair cells. Approaches to Petrus apex. ALF ETF, Elmore's, Lempertramadier, Fenckner's, Eagleton, Thornwald, Farrier. Elmore's, Lempertramadier, Fenckner's, Eagleton, Thornwald, Farrier. Elmore's approach, Lempertramadier's approach, Fenckner's, Eagleton, Thornwald, Farrier. ALF ETF. So Elmore's approach, Lempertramadier's, Fenckner's, Eagleton, Thornwald, and Farrier. So Eagleton, Thornwald is superior approach to Petrus apex. Eagleton, Thornwald is superior approach. Eagleton, Thornwald is superior approach, and Farrier is inferior approach. Elmore's approach space bounded by CCT, cochlea, carotid, tegment, tympani. Lempertramadier is space anterior to the Elmore's approach by removing Lempert, Lempert, PERT has PT. Here is PT is peritubal cells. Peritubal cells that exist between cochlea and carotid artery. Peritubal cells that exist between cochlea and carotid artery. PT, Lempert, PT, peritubal between cochlea and carotid artery. Fenckner's approach is approach through the arch of superior semicircular canal. Arch of superior semicircular canal. Fenckner's approach through the arch of superior semicircular canal. Eagleton's approach is a superior approach. Thornwald's approach is also superior approach. ET is a superior approach. Eagleton's approach, Thornwald's approach. Inferior approach is Farrier's approach. So Eagleton's approach is superior approach by remove of tegment to base of zygoma with squamous temporal bone. Tegment to base of zygoma together with a part of squamous temporal bone. Tegment to base of zygoma together with part of squamous bone. Dura of the middle cranial fossa is elevated to expose the Petrus apex. Tegment to base of zygoma together with part of squamous temporal bone. Tegment to base of zygoma together with part of squamous temporal bone. Tegment, Eagleton is tegment to base of zygoma. Eagleton, tegment to base of zygoma. Eagleton, tegment to base of zygoma together with part of squamous temporal bone. Thornwald's approach is superior approach, one more superior approach along supralabyrinthine tract. Thornwald supralabyrinthine tract, it merges with the Eagleton's approach anteriorly. Superior approach along the supralabyrinthine tract merges with the Eagleton's approach. Farrier's approach is inferior approach, that is infralabyrinthine space bounded by cochlea, carotid artery and jugular bone. Cochlea, carotid artery and jugular bone. Elmwood's approach is cochlea, carotid artery and tegment tympani. Farrier's approach is cochlea, carotid artery and jugular bulb. Thornwald's approach is supralabyrinthine tract. Superior approach supralabyrinthine tract. So next Eagleton's approach, superior approach Eagleton tegment to base of zygoma together with tegment to base of zygoma together. Tegment to Eagleton is tegment to base of zygoma together with squamous temporal bone. Tegment to base of zygoma together with sort of squamous temporal bone. So Farrier's approach, inferior approach, approach through face bounded by cochlea, carotid artery and jugular bulb.